Welcome to today's Practice Advantage Pearl. Today I'd like to talk a little bit about utilizing non-physician providers in a practice of specialty physicians. And at this time I'd like to talk a little bit about practices that are practicing spasticity management or movement disorder clinics. We've done a poll from 2012 until 2015 representing about 335 physicians on their utilization of non-physician providers, nurse practitioners, physician's assistants, advanced practice RNs, and other non-physician providers. The intent behind these, as MGMA reminds us, Medical Group Management Association, is to extend the therapeutic reach of the physician, help increase patient satisfaction with having encounters with non-physician providers, and in fact, it also improves clinical revenue. Overall, it's improved patient access. So the patient counseling, the patient encounter, the coordination of care, the triage and referral, the ability to help out with selected procedures, all those things can bring benefit to a practice. So how are they being utilized in this poll? Today, about 10% of the physicians still do not utilize a non-physician provider based on the poll we took. A large group, actually the largest group, 4 out of 10 or 41%, have a ratio of 2 physicians for 1 non-physician provider. So they're sharing a non-physician provider. There's another small group, it's 1 to 3, they're sharing a couple per physician. And then the ratio of 1 to 1 is about 28%, which is becoming more and more prevalent. So the trend is moving from sharing a non-physician provider to 1-to-1 ratio as we go forward. And finally, more than 1 nurse practitioner, PA, advanced practice RN per physician is only about 2 to 4% of the population at this point. So think about patient access in your particular group and whether or not it might be feasible to bring on board a non-physician provider, maybe in a shared capacity to start with, and build that to a ratio of 1 to 1. Thank you for joining us for today's Practice Advantage Pearl.